As the pandemic continues to affect us, it's clear there are so many more health conditions this crisis has caused or made worse. One of those conditions is diabetes, and right now I want to welcome Danielle Bradley, the manager of care management at Buckeye Health Plan. Danielle, thanks a lot for joining us today, and we're going to get right to it. As we said, the pandemic is actually having quite the effect on people with diabetes. Can you tell us more about that?
Yeah, absolutely. Thank you so much, Clyde. The COVID-19 pandemic has had a devastating effect on Ohioans with diabetes. It's impacted their ability to manage their condition. Many Ohioans have fallen victim to isolation and the disruption of COVID, resulting in poor management of their condition and in some cases even death. Diabetes-related deaths actually surged 17% last year to more than 100,000. Younger people between the ages of 25 to 44 actually suffered the sharpest increase with 29% jump. By comparison, all other causes of death, except those directly related to the coronavirus, rose 6%. And during National Diabetes Awareness Month, Buckeye Health Plan is encouraging Ohioans with diabetes or diabetes risk factors to take steps to prevent and manage the disease.
What is diabetes?
That's a really good question, Clyde. Thank you. Diabetes occurs when the pancreas can no longer make enough insulin to control blood sugar. It's most commonly from an autoimmune response if it's type 1 diabetes, or from the inability of the body's cells to respond correctly to insulin if it's type 2 diabetes. Type 2 is the most common form of diabetes, and it accounts for 90 to 95% of our cases. According to the CDC, those with diabetes have an increased risk for severe illness from COVID-19. And type 2 diabetes is associated with lifestyle factors such as obesity, poor diet, and lack of physical activity, all of which were difficult to focus on during the pandemic. In addition, those who did have the lack of physical activity, poor diets, and isolation actually had worsened outcomes because of the pandemic with their diabetes.
All right, now tell us how Buckeye Health Plan can help people manage or prevent diabetes.
Buckeye is an active community partner in educating members about diabetes management and potential health complications associated with the disease. Buckeye has a care management program that helps members with diabetes by providing frequent check-ins and ensuring that they're sticking to their medical plans and answering any questions they may have, providing guidance around doctor's appointments and directions for care, arranging member transportation to and from appointments if needed, and then becoming really a cheerleader for our members and making sure that they have a support system and someone who can help them along their healthcare journey. One other thing to point out is that Buckeye members can earn up to $150 in My Health Pays rewards for completing their well visit and annual comprehensive diabetes care, which includes their A1C test, a retinopathy screening, as well as a kidney screening. And then something important to note during this time within the pandemic is that in addition, until December 31st, Buckeye members can receive a $100 gift card for getting their first COVID vaccination. And anyone who's interested can visit covidvaxonthespot.com for more information.
All right, Danielle, thanks so much for joining us today.
Thank you so much for having me, Clyde. It's been a really good experience. We appreciate it.